Hey everyone, welcome back to our channel. Today we're looking into something real, something that isn't always easy to talk about, but it's so important to understand, especially if you have a loved one in hospice care or nearing the end of life. I want to talk about why some people don't seem to have a peaceful death. What causes that restlessness, that confusion, that agitation near the end? And to explain it clearly, I'm sharing what some hospice nurses and doctors said about the causes of restlessness in some patients before death. The first on the list of these professionals is Nurse Julie McFadden, a highly experienced hospice nurse who has seen over her decades of work. She has helped thousands of families go through this difficult time, and what she says can truly help you understand what's going on and how to handle it. One of the biggest reasons some people don't pass away peacefully is something called terminal agitation. This isn't something that happens to everyone, but when it does, it can be really hard to watch. It's often described by hospice nurses and doctors as a deep restlessness or a feeling like the person is unsettled, and it can show up in different ways. According to health professionals, some people may suddenly start walking around nonstop, even if they're weak. They'll pace back and forth, going from room to room, almost like they're looking for something. If you try to stop them or talk to them, they might not even seem to hear you. It's like they're in their own world. Others might be stuck in bed, but moving constantly, rolling, shifting, trying to get up when they physically can't. Some might cry out, speak in ways that don't make sense, or even yell, "Help me," over and over. It's heartbreaking. They might seem afraid or confused, and you, as the caregiver or family member, might feel helpless. Now, here's the big question. Why does terminal agitation happen? The truth is, sometimes we just don't know. There isn't always one clear answer, but nurses like Julie do everything they can to find out what's causing it. They look at things like, are they in pain? Are they constipated? Or do they need to use the bathroom but can't? Are there changes in their medications? Are they having trouble clearing toxins in the body, like high ammonia levels from liver failure? Nurse Julie says they always check the 3 Ps, pain, pee, and poop. Because, believe it or not, these 3 things are often the hidden reason someone is restless at the end. Sometimes just helping them urinate or have a bowel movement brings almost instant peace. That moment when they finally relax, that's a powerful thing to witness. But here's the tough part. Sometimes there's no obvious cause. They're not in pain, they're not on new meds, everything seems fine, but they're still restless, agitated, confused. That's when hospice nurses say this is terminal agitation. It can be unpredictable, it can be intense, and it often means that the person is entering the final stages of life. So how do nurses and doctors deal with this? Usually they turn to medication to calm the body, to ease the mind, and to help the person rest. Sometimes it takes a small dose. Sometimes, especially if the agitation is severe, it takes a lot more. The goal isn't to knock the person out, it's to help them feel safe, calm, and not scared. There are moments when the family has to decide, is it better for them to be awake and restless, or asleep and peaceful? That's not an easy decision, but it's one that hospice teams will help guide you through. Nurse Julie shared 3 powerful examples from real patients. One patient was quiet, then suddenly restless, clearing their throat, sitting up, lying back down, then repeating it. They checked everything, couldn't find a cause, so they treated it as terminal agitation, and medication helped bring calm. Another patient had mild signs, just twitching feet, moving hands, looking unsettled. It looked like dementia at first, but it turned out to be early agitation. Nurses gave medication early, which helped avoid things getting worse. The third was more vocal. The patient was yelling and moaning. First, they checked for pain and treated that. When the yelling didn't stop, they knew it was agitation. Again, medicine brought peace. Besides medication, there are simple things that make a big difference. Dim the lights, turn off loud TVs, play soft music, or use a gentle voice. Just hold their hand and speak calmly. Creating a peaceful space can truly help soothe their mind and body. And if you notice signs of restlessness early, like not sleeping well or sudden confusion, act fast. The sooner you support them, the less severe it can get. This topic isn't easy to talk about, but knowing what to expect and how to help can take away so much fear and confusion when the time comes. So if you're a caregiver or someone going through this with a loved one, know this: you're not alone. And what you're seeing, though painful, has meaning. Hospice teams are there to guide you, and there are ways to bring comfort and peace. Now, we've already listened to what Nurse Julie McFadden had to say about this deeply emotional and complex part of the dying process. But now, I want to take things further by sharing what other highly experienced hospice nurses and doctors have observed and learned from their years of caring for people in their final days. Each of them brings unique insights, real-life experiences, and compassionate perspectives that help us better understand what truly happens during this challenging stage of life, and how we can support our loved ones through it. Hospice nurse Penny, another experienced nurse who has worked in hospice for more than 15 years, uses a method she calls the 3 Ps: pain, pee, and poop. She says when a patient suddenly becomes restless, those are the first 3 things she checks. Penny shared a story about a man who was terminally ill and suddenly started thrashing in bed, groaning, and trying to get up. His family thought he was in severe pain or having a bad reaction to medication. But when Penny examined him, she found that his bladder was full and he couldn't urinate on his own. Once a catheter was placed, the man relaxed almost immediately and fell asleep peacefully. This shows that sometimes terminal agitation has a very simple physical cause. Penny says that when a patient is dying, they may not be able to communicate clearly. They can't say, "I'm in pain," or "I need to go to the bathroom," so their body speaks for them through restlessness and agitation. Dr. Jessica Zitter is a critical care and palliative care physician who has written books and produced films about dying with dignity. She emphasizes that not all terminal agitation is physical. Sometimes the root cause is emotional or spiritual. Dr. Zitter tells the story of a woman in her 70s who was dying from cancer. In her final days, she became extremely agitated, pulling at her blankets, shouting, even trying to get out of bed. The medical team checked everything: pain, infection, medications, but nothing seemed to help. Dr. Zitter sat with her and gently asked if she was afraid. That simple question opened a floodgate. The woman sobbed and said she was scared to die, scared of being forgotten, and scared of where she was going. Once those feelings were acknowledged and a spiritual care provider came in to support her, the agitation decreased. Dr. Zitter reminds us that people are not just bodies, they are souls with histories, fears, regrets, and hopes. Sometimes what they need most is someone to see them, to hear them, and to walk with them through their fear. Nurse Hadley has been a hospice nurse for over a decade and shares her experiences to educate families. She often sees agitation as a sign that someone is moving from the stage of dying into the final active phase. One experience she shared was of a man who had been peaceful for days and then suddenly started sitting up, swinging his legs, calling out for people who weren't there, and trying to get out of bed. His family panicked, thinking he was in pain or hallucinating. But Hadley knew this was a sign that his body was making its final transition. She sat with the family, explained what was happening, and helped them stay calm. They turned off the TV, dimmed the lights, and played his favorite music. He eventually calmed down and passed away peacefully the next morning. Hadley emphasizes that recognizing terminal agitation as part of the transition can help families avoid panic and instead offer comfort. Dr. B.J. Miller is a palliative care doctor known for his TED Talk and compassionate approach to dying. He encourages caregivers to treat agitation not only with medicine, but also with changes in the environment. He once cared for a patient who became severely agitated every afternoon. Medications helped a little, but didn't solve the issue. Dr. Miller said he noticed that the patient's room had bright fluorescent lights and a loud television playing news programs all day. He suggested turning off the TV, dimming the lights, and playing soft instrumental music. Within a day, the patient's agitation reduced dramatically. Dr. Miller says that people nearing death become extremely sensitive to their surroundings. Too much noise, light, or chaos can increase confusion and restlessness. Simple changes like calm voices, soft lighting, and a peaceful setting can do more than medicine sometimes. Nurse Carla Thomas, a hospice nurse with 20 years of bedside experience, speaks about the emotional baggage people carry at the end of life. She says that agitation can sometimes stem from unresolved issues, things people never said or did. Carla remembers a patient who became extremely agitated in her last days, yelling names, accusing people who weren't there, and refusing medication. Carla spent time with her and discovered the woman had been estranged from her daughter for decades. With the help of the hospice chaplain, they arranged a phone call between the mother and daughter. The two spoke, cried, and even laughed. The very next day, the woman was calmer and passed away 2 days later, peacefully. Carla said she believes that many patients become restless because something in their heart isn't at peace, and she encourages families to create space for reconciliation and final words. Dr. Michael Fratkin is a palliative care physician who runs a home-based hospice program. He reminds us to never stop investigating. He says too often families and even some clinicians jump to medicate without looking deeper. He tells the story of a man with late-stage lung disease who began showing severe agitation. At first, the team assumed it was end-stage restlessness, but Dr. Fratkin noticed the man's breathing was shallow and rapid. He suspected an underlying infection. A simple chest X-ray confirmed pneumonia, and antibiotics helped reduce the fever and confusion. The patient was able to have one last clear conversation with his wife before passing. He further stated that dying is not an excuse to stop caring. We still have to do the work of being present, being thoughtful, and asking questions. Linda Espinoza, a bilingual hospice nurse, shares that sometimes it's not about doing anything. It's about just being there. She recalls a case of an elderly man who didn't speak much English and became very agitated when unfamiliar caregivers entered the room. Linda, who spoke his native Spanish, began spending more time with him. She didn't always speak, but she held his hand, played traditional music, and brought comfort through familiarity. His agitation significantly decreased. Linda teaches that cultural understanding and emotional presence can ground a person who feels disoriented and scared. Sometimes restlessness is about fear, she says. And we calm fear not always with medicine, but with presence. Robert Jensen has worked in hospice for 18 years. He often sees terminal agitation peak just before death. He says it can be frightening for families, but it's often the body's final effort to let go. Robert shared a case where a woman became increasingly agitated despite medication. She was calling out for her mother, crying and trying to climb out of bed. He reassured the family that this behavior, though distressing, was part of the dying process. He helped the family stay close, talk gently to her, and remind her she was not alone. Eventually, she calmed and passed with her family around her. Robert says, "We don't always stop the agitation, but we can soften it with compassion, reassurance, and love." Now let's talk about medication. Many hospice professionals agree that medication is a helpful tool, but it should never be the first or only answer. In some cases, medication is absolutely necessary. One nurse shared a story of a patient who was thrashing in bed, yelling, and unable to sleep for hours. After trying everything else, they gave a dose of Ativan. Within minutes, the patient was relaxed and able to rest. But they also emphasized that before medicating, always rule out physical and emotional causes. Pain should be managed first. If there's fear or anxiety, sometimes talking or presence is more effective than drugs. When medications are used, the goal is not to sedate but to comfort. Hospice professionals often work closely with families to find the right balance, ensuring the patient is calm, safe, and respected in their final hours. Restlessness before death can be one of the most painful things for families to witness, but it doesn't mean the person is suffering needlessly. As we've heard from these experienced professionals, there are many causes, some physical, some emotional, some spiritual. The good news is that we can do something about it. Whether it's checking for physical discomfort, providing emotional support, adjusting the room environment, or using medication when needed, there are always steps we can take to bring peace. If you found this video helpful, please like and share it. Subscribe for more honest and compassionate content about end-of-life care. And if you've had an experience with terminal agitation, please share in the comments. Your story could help someone else going through the same thing. Thank you for being here, and thank you for caring.